So, hi, my name is Adam Gorman. I am a pediatrician at Comer Children's Hospital. I take care of kids from the days after they were born until they're in their early 20s with both wellness visits and any active concerns or things that they need help taking care of. It sort of always felt like a perfect fit for all of my interests. I knew that I loved working with kids and young people ever since I was in the end of high school, beginning of college, with my first job, if you want to call it like a job, as a camp counselor, and building those relationships there. And I wanted something where I could be challenged. I'm always learning new things. And combining that with my love of science and my previous love of helping people, it just always seemed like a perfect fit. Here at Comer, we really see a little bit of everything. And we also have all the resources in place to help take care of that little bit of everything that might walk in. From a newborn with a bunch of medical complications to your typical healthy 9-year-old that we just need to work on a little bit more fruits and vegetables, to a teenager with some mood concerns. I just feel like I could see anything walk through the door, and I love that diversity of experiences and medical conditions that I get to see here. I would say that I don't know if I have a specific philosophy, because I really think that every kid's a little different. And what works for one family or one child isn't going to work for another one. So I think in general it's just all about being flexible, really listening to what someone has to say, meeting them where they're at, and coming up with a solution that works the best for everybody. One of the best parts of my job as an outpatient pediatrician is that people can come in with really complicated problems, and we have the opportunity of following up with them and making little tweaks to plans over a longitudinal period of time. So, for example, if someone comes in with something like ADHD newly diagnosed, we could start a medication, we could make adjustments to that medication, we could help get someone enrolled in mental health resources, we could help work with their school. And then over months to years, you could really see some significant improvements and positive changes that might have not been there without our help, which is probably the most rewarding part of the job.